Okay. Welcome, everyone. My name is Catherine Ainsworth. I'm the CEO of Pony Club Australia, and it's a pleasure to have you all here tonight. This session will be recorded and posted on our YouTube channel as a resource for everyone after the session. A few housekeeping things. If you could use the chat box to put your questions, that would be very helpful. And then James has said that he's happy to answer some questions during the session, or we'll do them at the end. So introducing James. James is a proud South Australian who's now in Western Australia, and in a pony club sense has been a rider, a competitor, a member, a coach, a club president, and an international team manager. After practicing in various places, including South Australia, James is now at Oldbury Equine Clinic in Western Australia and is a specialist in equine dentistry. James also officiates at FEI and endurance and pony club events, and has a great experience in seeing the sorts of things that he'll be talking about tonight. So over to you, and thank you very much, James.
Thank you, Catherine. Good evening, everyone. I don't know how many people are here, but good to have a chat to as many people as we can get. So I've been asked to have a chat about equine emergencies tonight, but just quickly, Catherine's covered a bit of stuff about me. I started riding when I was 3, first show when I was 3.5. Started off in Pony Club back in 1996. Worked my way through a bunch of different disciplines, eventing and dressage, show jumping, mounted games. Then went off to university, 6 years of vet school. Continued to be a part of Pony Club during that time as an instructor on different club committees and those sorts of things. Graduated, and I've worked across South Australia and Western Australia in general equine practice. So we do everything, so colics, cuts, lamenesses, all those sorts of things. But of course, my special focus is in dentistry, which I just sort of fell into, but absolutely love. I have been with a trip to China for Pony Club with a rider exchange, which was just absolutely amazing. If anybody gets a chance to be a part of those, I'd highly recommend it. And I'm now working on my level 3 official vet status for FEI, which means I'll be able to officiate at events up to 4-star level. So looking forward to working on that. And so this evening, we're going to be covering equine emergencies. So what do I want to cover tonight? Well, it's a couple of things. What I really love about Pony Club is that the syllabus contains a lot of theory information about horse health. So I don't want to rehash too much of that because it's already in your C and especially your C-star syllabus content. But we will go through a little bit of the vital signs for your horses. So I thought I'd do things a little bit differently tonight. I want to go through some do's and don'ts on common presentations that we have in emergency after hours situations, and then how to engage with your veterinarian and contact them to get them to come and have a look at your horse, and how best to manage that situation so that it works for everybody, basically. As Catherine said, I'm more than happy to have questions as we go. Obviously, in the Zoom world, that's a bit harder than when we're all sitting in a room, but please just type them in the chat and Catherine will bring them up throughout, or if it can wait until the end, we'll cover it in the Q&A at the end. So, vital signs. Again, I'm not going to spend a huge amount of time on this, but I thought I'd cover a couple of key areas. So, heart rate. Theory notes always have a sort of a range, which is fine. Usually it's 24 to 40. But I'm not going to stress too much if your horse's heart rate is 22. Okay, that might be its normal low heart rate. What I'm really worried about is if it's elevated. So essentially higher than 40 beats per minute. So that's really the cutoff number that I want to know is happening. What I thought I'd take you through is how to properly use a stethoscope. So lots of people have a stethoscope, but unless you're using it on a semi-frequent basis, there's a few little tips and tricks for how to get the best out of getting a heart rate with your stethoscope. So most stethoscopes, unless you've bought a sort of cheapy one from Big W, are going to have these angled earpieces like this. So they're not going to be sitting directly from side to side. They're going to be angled forwards or backwards, depending on which way you're holding them. You want to have them so that they are facing towards the front of your face. So your nose is that way and the back of your head is this way, okay? If you have them facing the other way, the earbuds are going to sit on the edge of your ear canals and you're not actually going to be able to hear anything properly. So you always want to make sure your angled pieces are facing forwards. Now, if you've also got what we call a dual head stethoscope, so it's got two sides to the bell, they don't listen simultaneously. You actually have to select which side you're using. So to double check that, pop your earpieces in and then gently tap either side of the bell. Whichever side is loudest is going to be the side that you're currently listening to, and you won't hear anything from the other side. If it's the wrong side, if you want to be using the big side, you generally just twist the tubing until it clicks to the other side, double check it by tapping again, and you should be good to go with that dual head stethoscope. The final thing about using a stethoscope is how to hold it. So I hold it in what I would term a backhand technique. So I have my fingers either side of the bell there and have the tubing running along the back side of my hand, okay? That way you can get the bell right up against the body wall of the horse. Now, where are you going to do that? You need to locate the point of the elbow on the front limb, and then you're going to push your hand up under the point of the elbow, almost as far as it will go, and that's going to give you the optimal point to listen for a heartbeat, okay? If you follow those three things, or even two if you've only got a single-headed stethoscope, you should be able to get a reliable heart rate measurement. So the second big thing for us to look at is temperature. Now, the range I use is 37 to 38.5. I think the Pony Club books might do 37.5 to 38.5. Again, generally, I'm not concerned if it's too low. If you ring me and tell me it's got a temperature of 36, you probably just haven't stuck it in the butt far enough. What I'm more worried about, again, is an elevated temperature, so something over 38.5. But how do we get the correct temperature? The first thing is safety. So when you're holding the tail, again, I like to use this underhand technique, and then I've got a good hold of the dock of that tail, and you can see I've got full control of the back end of that horse, okay? I'm completely safe where I'm standing to the side and holding the dock like that. I see a lot of clients want to hold the tail off to the other side like this. You've got no control of the hind end of that horse. They'll suck that tail in and they'll make it really difficult for you and potentially dangerous. So hold it off to the side. With your thermometer, note the length of the shaft of the thermometer. You're then going to insert it into the anus right up to the point where the thermometer broadens. And then you're going to want to hold it against the rectal wall. Don't hold it right in the middle there because you might be in a little pocket of air or some manure. You want to hold it against the body wall to get an approximation of the body temperature, okay? I find a lot of clients either don't put it in far enough or just stick it straight in the middle, and they'll ring me and go, oh, it's got a temp of 35. Well, if it had a temp of 35, it's probably half dead. So I highly doubt that. I suspect it's because your technique needs to improve a little bit. Now, this isn't just important for your everyday horse at home, it's important for competitions. If you're monitoring your temperature up to and during a competition, you need to be able to reliably do this to make sure that you're able to know whether your horse has got any changes in its temperature. You don't want this to be a really variable measurement. You want it to be fairly consistent from day to day. All right, that's the two big ones. So there's a few other things that we can look at. Obviously, respiratory rate, it's generally around 12 beats per minute. There's a range of, like 6 to 18, depending on age and all of these other factors. Again, I'm not going to get too bogged down in the number. Generally, what you'll notice if there's an issue is you'll have an increased respiratory effort. So the horse is having to breathe harder, or you might see them panting, basically. In those instances, I'm going to be concerned about something going on. Mucous membranes, we talk about them being pale pink and moist. Unfortunately, I'm yet to have an owner actually properly understand what pale pink is. A lot of clients think that their gums are paler than they should be, when in fact they're perfectly normal. We talk about salmon pink color, but that's probably even too pink. It really is only, you know, slightly more pink than your hand, basically. We definitely want you to be able to know if they're moist or dry, because that's going to give us a potential indicator for dehydration. And then capillary refill time, I'm not really expecting most of you to be able to do this, but if you're a little bit more advanced with taking your vitals, essentially you press on the gum and blanch it so it goes white, and then you're measuring how long it takes to fill back up with blood or come pink again. And generally that should be less than 2 seconds. If it's prolonged, we've potentially got dehydration. And of course, you need to know all the other things about your horse. Its manure output. Is the manure normal consistency, normal volume, normal frequency? Are they eating normally? Is their appetite increased, decreased? Are they dropping food? And of course, drinking. You need to have a handle on whether your horse is properly drinking. If you've just got a big trough or an automatic waterer, you may not know this, so it's going to be really hard for you to tell. And a lot of times, really sick colics, people say, oh yes, they've been drinking, but actually they're potentially doing what we call death dunking, where they actually sort of stick their muzzle in the water and play with it, but they're not actually swallowing water. So it's important to know the difference. But the two big things I really want you to know is heart rate, temperature, how to take them, what your horse's normal is, and be able to report that to your veterinarian so that you've got some information. So let's cover some do's and don'ts on the common things that we see in after-hours emergencies. Now, these are colic, wounds, eyes, and sudden non-weight-bearing lamenesses. Okay, these are the things that we're seeing 99 times out of 100 when that phone rings after 5 p.m. Now, rather than just do, this is colic, this is what it looks like, this is how to manage it, which is sort of our traditional way of looking at it. Your theory notes generally cover a lot of this information of the clinical signs of colic, what to look for with wounds, and sort of basic management. So what I wanted to do tonight was really some specific do's and don'ts around these particular conditions. If you have any other questions, of course, just shoot them out and more than happy to answer them. So the first one for colic, as a don't, is walking them. Now, everybody's traditionally been told to walk a colic, and this is supposedly to stop them twisting their intestines, right? But how often do horses roll in the paddock? Just because they find a nice sandy patch, they've been hosed off, they have a roll. All the time, right? It's almost a daily thing. They have a bit of a roll in the paddock, right? How often do they twist their intestines? Almost never, right? It's not a common occurrence. So we really have to start questioning this whole causality between rolling and twisting intestines. What's generally happening is a bit of a chicken and egg scenario. You've got a horse that's down, violently rolling with colic, and the twist diagnosis is made when we arrive and determine how severe the colic is and what's caused it. And of course, everybody goes, oh, the horse must be rolling because it's got a twist. Sorry, let me take that back a bit. The horse got a twist because it was violently rolling, right? Well, actually, no, it was probably rolling because of the twist. Okay, so you've got to just make sure that you're not associating something that isn't actually there. If they were going to get twists from rolling, they'd do it all the time in the paddock, and they don't. Generally, it's that the twist happened first and they're violently rolling from it. So walking's not really going to do anything for you in that scenario. The only time I recommend for clients to walk their horse that's colicking is to keep it from injuring itself. If it's throwing itself around to the point that it's dangerous to you or them, get them up, get them moving just to stop them injuring themselves. Once the horse is seen, if it isn't a really disastrous colic, it's actually better to lunge them every 1 to 2 hours for 5 to 10 minutes at a trot. Trotting is much better for gut motility than walking. All you do walking your horse is tiring you and them out. You're not achieving anything from a gut motility perspective. So if your horse has received medical management and it needs to get its guts going again, it's actually better to lunge them periodically. So, oral remedies. horse owners love to stick things in their horse's mouth. And the list of those things is almost never ending. But one of the most common ones is berg oil. But I sort of challenge people that use it to wonder if they've ever actually looked at the ingredients for berg oil. The ingredients are Stockholm tar, turpentine oil, and methylated spirits. All of those ingredients are toxic to mucous membranes or the intestinal gut lining. So don't give it to your horse. My first boss used to have this fantastic response to clients when they asked about berg oil. She'd say, you drink a cup first, and if you still want to give it to your horse, go for it. Now, I wouldn't really recommend that because I might get in trouble, but it's just horribly toxic stuff, and there's just no place for that in colic management in horses. Another common one that we'll get is warm flat beer. Oh, I gave it a warm flat beer. Well, you've got two issues here. Alcohol may dehydrate the horse. If it's already dehydrated, you're going to make the issue worse. And it's really a small volume. It's not going to do anything for rehydrating or lubricating an impaction or anything like that. So again, my first boss was fantastic. She said, you drink the warm flat beer and then call me. It's just got no place in your horse, okay? I hear of milk and honey and a vast number of other oral remedies that people like to stick in their horses' mouths. Please don't give any of these in place of prompt veterinary attention. When you ring and say, oh, well, I was colicking at 10 this morning and we gave it some berg oil, that didn't really do anything. So about 4 o'clock, it was still colicking, so we gave it some milk and honey. It's now midnight and the horse is no better. Okay, it's the fastest way to have your veterinarian lose your number. Don't do it. All right, oil. So lots of you might have heard that your veterinarian gave oil via a nasogastric tube. Really common, okay? What's important to know is what that oil actually is. So generally we're using paraffin oil, which is an inert petroleum-based oil, and it's intended to go all the way through the intestinal tract of the horse. It doesn't do anything, it's not absorbed by the horse at all, because what we want it to do is lubricate and break up impactions to keep things moving through. Generally what you guys will have at home are vegetable oils. So canola oil, sunflower oil, olive oil, something like that. The issue with these plant-based oils is that they're absorbed by the intestines. They're not going to move anything through because they don't go all the way through the intestinal tract. They're just a source of fat in the diet. So they're actually not going to do anything for a colic. Even if you do have paraffin oil, you're usually not going to be able to get enough in via the oral cavity, syringing it in. You need litres of stuff, not millilitres. So it can really only be administered in large quantities via a nasogastric tube. You also risk aspirating it by trying to squirt it in a horse's mouth. So generally don't give your horse oil. Wait for your veterinarian to administer what they recommend. Last one, bute. Now, you've all got a tub of bute or some bute sachets sitting at home in your tack shed, all right? You've had a wound or a lameness or something at some stage and you've had a course of bute and you've got a bit left over. Everybody has that. Bute is a non-steroidal anti-inflammatory drug and it is good for musculoskeletal and eye pain. Absolutely fine. The problem is it's not good for gut pain. We tend to use flunixin for colics because it's much better for abdominal pain. Now, the problem is that these two drugs are the same class of drug. Doubling up on their use can actually be bad for the horse's kidneys. Now, yes, we have to give really high doses to really damage the kidneys, but we try to avoid doubling up on these wherever possible because it just isn't a good practice, especially if this horse is already dehydrated in colic, which means the kidneys are already under stress. And now we're talking about potentially having to use 2 different drugs, right? So this is a really bad practice. So what happens is you may actually restrict what we're able to use to control your horse's colic pain by giving bute first, because the bute won't work. I can tell you that now. I've had enough clients ring and go, oh yeah, well, I gave it bute an hour ago and it's still colicking. Well, yeah, because the bute's not good for colic pain. Now I can't use flunixin because you've already dosed it with a non-steroidal. So please don't use bute unless it's under the direction of your vet. If you've rung them and they said, look, I'm not going to be there for a couple of hours. You've got some bute, try that first, and then I'll get there as soon as I can, but otherwise don't give bute. So what can you do if your horse is colicking? Call for a vet immediately. Don't wait 1, 2, 6, 12 hours to ring us, because all you're doing is making that case infinitely more difficult to solve. Even if we can't get there straight away, we can at least advise you on what you can do. While we're coming, ensure that you and the horse are in a safe environment. Okay, if the horse is thrashing around, make sure it's in an open area, soft, sandy round yard, something like that, and don't get yourself injured in the process. If they just want to lay down, let them lay down quietly. Okay, don't have to go hooing and hawing and getting them up just because they want to lay down. That's where they're comfortable. Let them lay down. As I said before, only walk them if you need to stop them from injuring themselves, because the walking is not doing anything for your colic. Provide access to water. You can make up a molasses water mix if you like, make it about weak to strong tea colour. Most of these colics aren't going to drink it, but if they do, that's awesome. The more oral fluids we can get in, the better we're going to be. Take away food. Even if they've got an appetite, I don't want them eating, okay? It's good to know that they have an appetite so you can offer them something to test it, but take that food away again. If they're potentially brewing an impaction or have a partial displacement or something like that, we don't want to fill the gut up with more food. So please take food away. Don't administer any medications unless directed by your veterinarian. And generally employ the KISS method. Keep it simple, stupid, okay? Don't throw all sorts of weird things in your horse. Ring for assistance and we'll help you out with what you can do. So that's colic. So, wounds. Some things to avoid for wounds. So, please don't apply tough rock like clay poultices, copper sulfate, all these other powders and potions to open wounds. In general, a good rule of thumb is if you wouldn't put it in your own eye, don't put it in your horse's wound, okay? Wounds are a sensitive environment. They've got cells that need to heal. You don't want to go throwing stuff in there that is toxic. Copper sulfate is cytotoxic. It will kill cells. And clay poultice is just another form of dirt. It's not sterile. It's not antibacterial. All you're doing is mashing dirt into an open wound, okay? If you've just got puffy legs after being in a stable overnight or from the cross country, that's fine. But in an open wound, don't do it. Never apply cohesive bandage, which is your vet wrap, so your stretchy stuff, directly to skin. Unfortunately, I've seen some really bad consequences of this, where people have wrapped either tails or legs just with vet wrap. The issue is that the cohesive bandage, which sticks to itself, it isn't naturally adhesive, is also constricting. It tightens on itself. It's designed to be used over the top of padding. If you use it without padding, what you'll actually create is a constriction of the tissue and potentially cause the skin to slough off, fall off. And I've seen that. So please, vet wrap is only to be applied on top of padding. Even if it's a short-term wrap, just to stop some bleeding or keep a wound clean, do not apply vet wrap directly to the skin. Also, don't remove foreign bodies, which is just the same principle as human first aid. So if you've got a nail in the foot like this x-ray here, if you go and pull that out before we get there, we won't be able to make an x-ray like this. Now, why do we want to do that? Well, we want to be able to determine which structures the foreign body has potentially damaged. Now, if you take the foreign body out, you're not left with a lovely little track there. That will close up and you won't see where the foreign body's been. Then we can't tell, has it gone near bone, has it gone near tendon? And therefore we may not be able to assess the severity of that wound properly, and you might end up having complications down the track. So just the same as human first aid, leave the foreign body in place, make a donut wrap or a wrap around it to just stabilize things until we can get there and make an assessment of it. So what should you do with wounds? You're more than welcome to clean the wound, obviously. Again, I don't really stress about making up saline solutions or even antiseptics at this point. Just clean running water is the first thing to get the dirt and the gravel and the grit and sand and everything off of your wound, okay? If you need to apply a wrap, for minor wounds, the only sort of objective of that at this stage is just to keep them clean, so the horse is not kicking more dirt or poo or whatever into it. If you've got bleeding wounds and you want to slow or stop the blood, you obviously put a thick bandage on that. And again, just the same as human first aid. If it bleeds through the first bandage, don't take it off, apply another one on top, okay? You keep applying sandwiches of bandage until the bleeding stops coming through, okay? Same as human first aid. And then anything that is near a joint or tendon or an eye is an emergency. So a wound like this one here that I've got pictured over the hock, you must call for assistance immediately. If you wait a couple of days to see how this heals, you're potentially opening yourself to a joint infection. And, you know, probably a lot of you here tonight are rolling your eyes going, oh, I wouldn't do that. I'm put these things in here specifically because I have had clients do these things. If you leave yourself open to joint infections, not only is this now infinitely harder to heal, but you've potentially got a lot worse long-term complications with arthritis or tendonitis and a whole bag of other nastiness that is a lot harder to heal. So anything near a joint or tendon or an eye is an emergency. So moving on to eyes, what are some don'ts? Don't ignore them. Eyes get worse really, really quickly. And unfortunately, they get exponentially more difficult and expensive to deal with the longer you sit on them. So you don't want to end up in a situation where we are here, although this wasn't one that was sort of purposefully left, it was a later treatment, but you may end up having to have surgery here with a specialist if you ignore an eye. And that's going to be a lot worse than if we saw it immediately and just had to put some ointment in it. Now, some of you might have heard of putting weak, cold black tea in your horse's eye. The only indication for this is mild conjunctivitis. It is contraindicated for anything else, such as ulcers or wounds or anything like that. So please don't use it until after a diagnosis has been made. If we say it's just got some conjunctivitis, the cornea is perfectly intact and you want to use some cold weak tea and your veterinarian approves, go your hardest. Again, don't put cold weak tea in it for 3 days and then ring us and go, it's not getting better. Again, it's one of the fastest ways for your veterinarian to lose your number, and we don't want to do that. And again, just like wounds, if you wouldn't put it in your eye, don't put it in your horse's eye. It's a good rule of thumb, okay? Anything you wouldn't put in your eye is probably going to be cytotoxic, and you don't want to put it near anything that's trying to heal or is sensitive. So what should you do with eyes? Obviously, again, seek veterinary advice immediately on these before they go downhill. If you've rung us and say we can't get there straight away because we're dealing with some other emergencies or we're out of the area for the evening and can't get there till the morning, if you've got some eye ointments on hand, you can use those under advice, okay? So tell us, look, I've got some chloramphenicol here from another horse, I've got some tricin here from another horse. We'll probably say that's fine to start with. You can't use anything with steroids in it, so corticosteroids, so your prednisolone forts or your amazons or anything like that, because in horse eyes, that actually makes ulcers worse. So you do need to be clear and careful about what you're putting in an eye. You can obviously wash around the eye, remove dirt and grit from there. If they've been rolling around in sand and then fill their eye up with sand, you can happily wash all of that out. And most times when horses develop corneal ulceration, it's really painful and sensitive to light. So more than welcome to keep them covered with a fly veil to keep their pain levels down. So the last thing that we probably commonly see in after hours emergencies is the sudden lameness, so that you get home and the horse is non-weight bearing lame. So this is either one of two things. It is either a hoof abscess or a fracture. Now, obviously, those two things are worlds apart in terms of their severity and importance to your horse. So, in general, fractures are really, really uncommon. We'll probably see about 1% of these sudden lameness cases are a fracture. Generally, your horse will be standing completely still. It will not want to move a muscle. It will often be sweating either all over or in particular the damaged leg because it's so painful. They might be showing a pain face, which I know these days is part of your Pony Club syllabus teachings, or the horse might be overall generally depressed, or you might have a severe swelling of that particular leg, and usually it's, you know, up here on the forearm or near the shoulder. It's abnormally swollen. Those ones, if you relate all of those things to us, we're going to find the warp speed on our vehicles, and we're going to beat you super quick. Don't use that as a reason to get us out quicker. But if you're telling us these things, we're going to be really concerned about that. Now, 99% of the time, it's a hoof abscess. Okay, the horses will generally still be mobile. They'll be more than happy to walk across the paddock slowly, limping on that leg. And there might be some mild swelling of the pastern, or sometimes up the pastern and the distal cannon, you know, in really sort of intense hoof abscesses. That's a consequence of that swelling in the hoof capsule. So generally, you're not going to see the sweating. They're not going to have the pain face, and they're generally more than happy to move. But they're the sort of things you're looking for. Either way, you know, you're going to get us out to start the process of helping either this heal or finding out what we need to do if it's a fracture. So that's the common stuff you're going to be presented with yourselves as horse owners as sort of emergency situations. So I want to go through what you need to do when you call your vet. So I want to take a quick moment, and hopefully Pony Club doesn't mind about this, to talk about Sophie's legacy. So who is Sophie? Sophie Putland was a colleague of mine. We went through university together. So we spent 6 years of studying and partying and being friends. And Sophie was an absolute legend. She was a horse rider. She'd done track riding, and then had obviously graduated and started working in the veterinary industry. Unfortunately, in 2021, Sophie suffered a mental health crisis as a consequence of some horrendous client abuse, and ended up taking her own life. So this hit us really hard. Sophie was not the sort of person that you traditionally, you know, associate with depression. She was a fit and active person. She had a great friend group, and we were really blown away by this, unfortunately. Her parents have decided to try and make something of this horrible loss, and have started Sophie's Legacy as a charity foundation. And the outcome that they've had of sort of industry consultation is that a lot of the time veterinarians don't feel like we're treated as human beings by clients. I've really sort of resonated with this theory. I feel like we're sort of treated like a vending machine. We have coins put in and we're expected to pop out a service, and that's where it stops, and that's where we're treated. And, you know, if people are not feeling well themselves and they're angry at the machine, they're quite happy to give it a kick and a punch and yell at it to give me my damn chocolate. But the problem is that we aren't vending machines. We are human beings. So if anybody wants to check out Sophie's Legacy, you can just Google that, and you can take the pledge there. So how do we actually physically go about treating our veterinarians as human beings? So when you call the vet, you obviously need to have their after hours number available. Lots of clients don't have this or haven't asked the question of what's the after hours number. Most practices, it will be the same number. So for us, you call the 1300 number, and 24/7 that either goes through to the reception or goes through to the on-call vet. Some practices might have a separate after hours mobile number that you need to ring, so you need to have that number handy. If you happen to have your veterinarian's personal number, You might have texted some pictures through to them before, or they've texted you some blood results in the past. Please don't ring that number. Please respect that number and that boundary, okay? We love you guys, but they might not be the vet on call. They might be out with a partner or their kids. You don't want to disturb them. Please ring the clinic after hours number. Try and have a relationship with your veterinary provider. Make sure that you've come in for dentals, vaccinations, health checks, routine blood work, fecal egg counts, something before you need them in an emergency. If you happen to have just moved to the area and just haven't had a chance to do that yet, just state you're a new client. The main reason is we may need to just collect more information from you when you ring, okay? So we just need to know who you are and what your relationship is with our practice. Another thing is to know your own number. Quite often when clients ring me after hours and I go, okay, what's your best contact number? Oh, well, I left my phone at home and this is my neighbour's phone I'm ringing on. I don't know the number. Guys, we might need to ring you. We might not be able to find your property when we're on our way. We need someone to contact. We might be dealing with another case and we need to ring you when we're leaving. You need to have a contact number and know what that is. Also, put the horse person on the phone. Now, I know your horse might be rolling around and painful, but when you put grandma on the phone and she's got no idea about horses and we're trying to collect information from her, what's wrong with the horse? Oh, I don't know. What's the horse doing? Oh, it doesn't look well. Not really helpful for us, okay? We need to be able to triage our calls, especially if we've got a few on the go. So either put yourself or someone that's a horsey person on the phone so that they can describe the situation to us. Now, this is the big one. Know your address and be specific. If you ring and I ask for your address and you go, oh, well, you turn down this road and then after the third house on the left, you then turn right. And then when you see the green roof, you turn left and then it's the property with the cone out the front. I stopped listening about 3 directions ago, okay? Because it is just totally not useful to me whatsoever. The reason being is that while you noticed the green roof on that house, the rest of the street actually has 3 different green roofs on it, and we're going to be looking at all of them. And the orange cone out the front of your address that seems like a really good idea, everybody else in the street seemed like it was a good idea too and have orange cones as well, and now we don't know which driveway it is, okay? So these council numbers that lots of places have now out the front, they might be white and black, they might be green and white, whatever they be, is a fantastic number. It serves 2 purposes. It is a specific address to give us, so know that number. And also, in most places, they are a distance. So this number, 508, is 5.08 kilometres from the intersection. So even if we're really stuck, we can put our odometer on and we can somehow find you. So know your address and be specific. What I tend to say to clients when they start rambling on about some turn left, turn right, hop on one foot and turn upside down is I stop them and I say, what do you put in Google Maps to find the place? It's a good place to start. Now, try to be kind. If you've rung us at 1 in the morning, it's a high likelihood we were sleeping and you might have just woken us up. It might take us a moment to get with the program. We are very good at going from 0 to 100 in quite a short amount of time, but do be kind. For a little bit foggy, might be because we're still waking up. So just hold with us while we get with the program. Handy other tip to have is know your horse's vaccination status. Obviously for tetanus, that's a given for all horses in all areas. But if you are in a Hendra endemic region, so northern New South Wales and Queensland, that might actually be dependent on whether you're able to get veterinary assistance from the practice you've run. And so you're going to need to know that detail before they're going to come out to you. So make sure you have that information handy. And don't lie. It doesn't save anybody any hassle. Just makes things worse. So some other things that I commonly encounter after hours is clients need to know your contingency plans. Is surgery an option? If this is a surgical colic or a fracture, is that a viable option for you? When you're in that scenario of trying to deal with the issue, it's kind of a bit late to be thinking about these things. Colic surgery here in WA, we quote between $10,000 and $20,000, which is a huge chunk of money. You might have your horse insured, but you need to know all of these things before the emergency happens, okay? Unfortunately, not all after-hours emergencies go well, and sometimes we have live horses, sometimes we have dead horses. Before this happens, you need to know what your body disposal option is. You need to know your local laws. Is burial an option under the EPA rules for this property? Or is there disposal options for local burial or composting, or you want to cremate your horse? You need to know these things and their costs associated, because usually it's not got anything to do with the vet practice, prior to being presented, unfortunately, with a deceased horse. The last contingency plan you need to have in place is transport to hospital. If you've got your own floating vehicle and somebody that can drive it, sweet. If you have to rely on somebody else, you need to have that plan in place again before it's 1 a.m. in the morning and you need to transport a horse, okay? So you need to know what floats have you got access to. Ideally have 2 different options. And do you have towing vehicles for those floats? Again, have a couple of options, because then at least one combination out of that lot might be available when you need it. Unfortunately, I've known lots of cases where it's taken several hours for those horses to get properly treated because owners have just not had any idea on how they were going to transport them in for, intravenous fluids or further workup or whatever's going on. And those horses have had to wait hours before they get treated, which is not what we want. If you can, bring the horses into the clinic wherever possible. It's generally a nice, warm-ish, dry, well-lit environment to see your horses in. We've got all of the equipment we need there with blood machines or x-rays or ultrasounds or whatever we need to properly work up that case. And it might allow us to see a couple of patients in a shorter period of time than having to drive all over our catchment area to come to you. So if possible, bring your horse in. It's probably going to save you money. Most of the time, clinic consults are cheaper, you're not paying travel, and it's going to be better for you and your horse. If we do have to come out to you, please make sure that when we're expected to arrive, your horse is caught and you have a competent handler on the horse. I have been to countless field calls and arrived, and the horse is way off in the distance. And then I've had to wait half an hour, 45 minutes for that to be caught. I've also had the non-horsey next door neighbour who's been there holding a horse. And at best, they don't know what they're doing. At worst, they're scared of the horse. And in that situation, they're now no longer safe. I'm no longer safe to be able to examine your horse. And there's a high likelihood I'm not going to be able to do what I need to do with your horse. So please have it caught and ready with a competent handler when we're on our way. Finally, please be prepared to pay your bill. Veterinary clinics are not banks. We can't provide you lines of credit. We don't have gazillions of dollars sitting in the bank account to be able to carry clients not paying their bills. You don't go to the supermarket and wander out without paying. You don't tell the checkout lady at Woolies that, "Oh, send me the email and I'll pay it in a month's time." It doesn't work like that. Very few mechanics these days allow you to drive out without paying for your service or repairs. You need to be prepared to pay your bill. Veterinary clinics are no different to any other service provider. Now, I acknowledge that emergencies happen generally when you least expect it. Horses are expensive. If you need to use a third-party credit provider, such as VetPay or GE Money or something like that, you need to have that ready beforehand and notify us that you're doing that, because we have to process that differently and we need to know that we have to do that. So those things are okay, but you need to have it organised beforehand and you need to let us know about that. All right, so you've rung us. You've been a fantastic client. I wonder if I've got any veterinarians on here tonight. That would be interesting. If you are a vet, just put it in the chat, because I'd love to do a mock call with you. But you've rung us. You've been clear on what's wrong with the horse. You've been clear on your address. We've put your details in our system. We are on our way to you. What do you need to have ready? Well, very few even clinics, let alone horse properties, have a lovely examination room like this one, where you've got a beautiful set of stocks and hot and cold running water and lovely roof over your head. But what can you guys achieve? Well, to start with, have a halter and lead rope. A few of you might be chuckling. Sadly, not funny, because again, I've turned up and I've looked at a horse in the paddock and gone, somebody want to catch it? Oh yeah. 15 minutes later, we've fossicked around through the tack shed and found a halter and lead rope. Be ready. It can be handy to have some buckets. We'll quite often have stuff with us, but some buckets to either put antiseptic ointment solution in to clean stuff, or even to carry stuff around. Very handy to have. Ideally, if you can, running water, tap and hose. Fantastic for wounds if we need to hose stuff off, or fill up buckets to drench horses with water. If you've got that, try and be there near that, ready to go, or have your hose out near us. If you've got the option, power and extension cords. Our practice, all of our equipment is battery operated, but some practices still have equipment such as x-rays that need 240 volt power. So if you've got the ability to have power and an extension cord ready to go, awesome. Ideally lights. I know it's going to be, you know, in the paddock in the middle of the night. That's when it always is. But if you could move up to near your stables, or even just a shed with some lights on it, it's just going to make it much easier for us to be able to assess what's going on. Some old towels handy. You often have these for when you're washing for shows and things like that, or applying makeup for competitions. Grab a couple of those and have them handy. And that's horse makeup, not your makeup. I'm hoping you're not applying it with towels. Have a table handy, something that we can put our equipment on. You know, if we've got an x-ray or an ultrasound, we don't want that sitting in the mud, because I know how much they cost, because I broke our x-ray last year. That didn't go down well. So make sure we've got somewhere to put that. And don't forget your payment method, okay? One of the ways to, again, have us lose your number is you get to the end of the consult and you go, oh, I left my purse at home. Have a think about that before you get in the car and go see your horse. Everybody these days has a card on their phone in a payment app. So, you know, make that one your emergency horse card so that it's available. Everybody's got their phone with them. Apple Watches. I had a lady one day, I got the F+ ready and she just went like that and it beeped. And I was like, hey, it was her Apple Watch. So there's really no excuse not to have your payment method available. So what are you going to have in your kit? You want to put a wrap on to keep a wound clean while we're on our way, or treat a wound once we've been. PCA do have a document on human and horse first aid kits that you can look up. I have to confess, I find that the horse kit a little bit difficult to read what's on it. So I thought I'd just smooth out what's in there. So cotton wool or gauze swabs. You're going to use this for cleaning wounds. I don't mind cotton wool for cleaning wounds. I know some people don't like it because it has the little fibres that can be left behind. In that case, use some gauze swabs. Antiseptic solution, either iodine, the brown stuff, or chlorhexidine, the pink stuff. Again, when you make this up, it's very weak dilutions. You just need to tinge the water with it. It doesn't need to be super strong. Non-adherent dressings, so these are your melilins. These are what you apply with some ointment directly to the wound. With those, there's a shiny side and a non-shiny side. It's the shiny side to the wound. You want some padding. I prefer to use cotton gauze, so cotton wool with a gauze layer on the outside. That holds together a lot better than just using cotton wool. One of the brand names is Gamgee. There's a whole bunch of different other ones like Combine and that out there, but cotton gauze padding. Now, your non-stick bandages, so your vet wrap, Coflex, they're your cohesive bandages. Those ones are what you apply pressure over the top of padding to stabilize a wound. Your sticky adhesive bandages, which is your elastoplast, your Skinas, those you might use top and bottom just to stabilize a bandage to stop it from slipping. Tape, just some duct tape is really handy to have. You can put it over the top of a bandage to keep it dry, or just to hold the last wrap of your elastoplast in place, or you can use it really well for a hoof poultice to hold that on. Have some disposable gloves. Again, you're not really going to be contracting anything from your horses, but you don't want to be putting your skin bacteria into wounds and things like that. Hoof poultice, Animal Intex is the most common brand name, but there's lots of others. That's designed to create the concentration gradient to draw the pus out. So you're going to have some of that on hand. Nice clean bucket. Now you can get a big bucket with a lid and actually use that as your first aid kit to carry it around in. And then you've got a bucket handy to clean things with. Some scissors, either some bandage scissors like these ones or just some household scissors for cutting off the ends of your bandage as you wrap it. Your thermometer, make sure you know how to use it. Stethoscope, again, make sure you know how to use it. You might have some wound ointment. There's every wound ointment under the sun that you can buy at Horseland and photo stores, stock feeders. I'll either recommend having Flamazine or honey or under a wrap or Dermapred on an open wound. But again, you're not really going to be using these unless you've spoken to your veterinarian first, but you might have them on hand. Cetrogen, which is your purple spray. I always, sort of a bit of an old joke, is that purple spray is just there to let other people know you know the wound is there. But it does have some fly repellent stuff, but it really doesn't do anything from an antiseptic point of view per se. Petroleum jelly, so Vaseline, is really handy to have, especially when you get those cuts or abscesses up under the jaw and it drains pus. You can actually put that along where it's draining so that the pus doesn't scald the skin. So that's handy to have. You can also use it with your thermometer if you want to be a little bit kinder when taking your temperature. A flushing syringe, again, good for those wounds or abscesses that you need to flush. Some wire cutters. Where do horses like to get themselves stuck? In fences. What can you never find when you need them? Wire cutters. Have a pair in your first aid kit so you know where to find them at all times. And finally, when do horses like to injure themselves? At night. It is invariably in the pitch black that they've done something stupid. So have a torch in your first aid kit, but do periodically check the batteries. There's nothing worse than having a torch with flat batteries in it. So that's a standard first aid kit that covers most of the emergencies you're going to be dealing with. So hopefully I haven't bored you all so far. So just to sum up, when do you call us? Well, any colic, don't sit on those. Any large wounds, especially near joints, tendons or eyes, or any eye injuries on the actual globe itself. Any lamenesses, again, don't sit on them. You don't want to wait until you've got a horrible skin infection or something like that. Any severe infection or inflammation, so big tree trunk, swollen legs, horrible things oozing pus, give us a call. We're going to want to deal with that sooner rather than later. In general, and this is what I have on my syllabus slides for C and C stars, is anything you don't feel comfortable dealing with on your own. Now that's going to vary from person to person, but that's your own barometer, okay? You might ring for assistance for anything wrong with your horse, and that's fine. Or you might be able to treat a minor wound yourself, and you know, if it happens to get swollen or something, do call for assistance. That's totally fine. Whatever you're not comfortable dealing with, give us a call. We're there to help. When you do call us, know your details, be specific. Have your phone number, have your address, describe the situation. Be prepared for us. Have some lighting, have a nice open, dry area if possible. Be kind. We are human beings and we are doing our best to provide you a service. We know you're stressed, but at the same time, please don't take it out on us. Be ready to pay your bill, have your payment method available, or discuss with us what your payment method needs to be. And if possible, bring your horse to us. It's going to help best. All right, that's me. Thank you very much, everyone. I think we've got a Q&A now, but hopefully that's given you some tools for your next emergency.
Thank you very much. We do have one question already. Why is it that horses present with these problems at night and after hours?
Yeah, I mean, it's not just exclusively after hours. We have plenty of colics and cuts and lamenesses during the day as well. It's just more that these are the things that you can't wait until tomorrow. Okay, you know, if your horse is dropping a bit of food, you notice in the evening, you can call us the next day to book in a dental examination. Okay, it's not an emergency situation that night. But if your horse is limping around the paddock, or it's sliced itself open, or it's rolling around with colic, that's not something you wait until 9:30 the next day to call us with. So this is generally the stuff that has to be dealt with immediately. And if that occurs at night, it's going to end up being an after hours emergency. I hope that answers the question.
Okay. Choke. You haven't spoken about choke, but is there anything besides wetting the feed that can help to prevent it?
Depends what the choke's being caused from. So I would have to say that over half of the chokes that we see are carrot. Or they're just being fed a carrot. The horses are allowed to munch it up on their own, and a lovely cylindrical piece of carrot gets stuck in the esophagus. So I'll either recommend that people don't feed carrot, or you slice it up like you would put in your stir fry before you actually give it to your horses. For chokes that are happening from food, so hard feed, a little bit tricky. Those ones I often find usually somebody's filled a bucket of food to catch the horse for the farrier or to bring it in or something like that, and it's probably out of the normal time frame for that horse getting fed, and it's gone food, and it's just dived in the bucket and just hoovered up a whole chunk of pellets or something, and then that's got stuck. So it's not usually just their normal hard feed. In those instances, I'd start to question whether there's something going on in the mouth that's causing them not to be able to masticate or chew their food properly. And so I'd recommend getting a dental exam just to make sure that that horse is chewing properly.
Okay. We have some thank yous for the presentation. Oh, here we go. How do you treat a horse that is tying up? Should it be walked?
Yes. So yeah, you've got to get the inflammation under control. So we'll often use a combination of non-steroidal and steroidal anti-inflammatories with that. Potentially they need rehydration, so oral or IV fluids, to prevent the lactic acid buildup in those muscles, creating further damage. Once the sort of inciting inflammation is controlled, then yes, walking is useful to help stretch and soften those muscles.
Okay. That's the last question that's there now. It's 8:30, but I'll just ask one question. Comes to the preparedness that event organisers should have, and I guess here calling upon your experience as officiating at events and how event organisers can be more prepared.
So, I mean, I've seen everything from events where we haven't had to look at a single horse through to fatalities at events. So you really never know what is going to be presented at an event. I did Pony Club Nationals in South Australia back in 2015, and I was a recent graduate at that stage, and I'd have to say I probably wasn't fully prepared for that event. I've certainly learned a lot at it. So where possible, find a veterinarian who has event experience providing those services. And if you're trying to bring on somebody new in the area to develop them with those skills, try and have them work with someone that's done events before. It's going to serve both the event and your local provider in the long run. In terms of what to have available, it's how long is a piece of string, really, with those sorts of things. I personally think that every state centre, either EA and or Pony Club, should have a large animal rescue kit, and events such as particularly cross-country phases should have that on site. because, you know, again, had a fatality, and I didn't check myself, but I had been assured by the event organisers that they had ropes and straps and things available, and turned out we didn't have any. So I now have a large animal rescue kit, which I might just, if you guys are cool with that, now, here it is. So I have put together this. Can I see? Let's just do that. That'll do. So I've put together this kit with Marianne Layton, who is sort of the guru of technical large animal rescue here in Australia. So this consists of a modular glide system with a bar, multiple different straps of 5 and 8 metre length, a head carry sheet, what's called a strop guide. So this is what you use to pass straps underneath the horse. Limb guides, so that you can move a leg, you know, poke it out of a hole somewhere without having to be down there holding it, and a Kimsey splint. So this is a type of splint for stabilising a leg that might be injured. So I have this kit that I've personally put together, and I take that to the events that I officiate at. This is the sort of thing I think should be in every state EA or pony club office and available for hire for events that are having high risk activities. You know, it's not I wouldn't stress about it at dressage, but for cross country, I'd have this in my ambulance float on the field of play.
So we can't see that, James. So I don't know if you're looking at something, we can't see it.
That's a good question. Okay, I am screen sharing, but why is that not coming up?
Perhaps if you stop share on your PowerPoint and then open the next one.
Sure, let me just try that. Sorry, I thought it was showing up. Zoom. Oops. Sorry, team. Technical difficulty. Hold with me for a moment. Give me what I want here. That's what I want. Screen share. Is that showing up?
Yes.
Okay, perfect. Sorry. So this is the glide mat. So it's modular, so it will fit in my car nicely. And it has the metal bar up here for attaching straps to. I've got the 5 metre and the 8 metre straps here. This is the head carry sheet, which folds out to support a head as the horse is being moved. This is your strop guide. So this is the thing that you pass under a horse to grab a strap and pull back through. These are your limb crooks, and that's the Kimsey splint. So this is what I have available for events that I take with me. Again, I haven't used this at an event because I didn't have it with my previous incidences, didn't have it then, but I have used this equipment actually in my day-to-day with mud rescues and float rescues. So it's useful stuff, but I would recommend that this was available. And you literally, I have this down in a bag and you know, the slides there, and I put that in the ambulance float for the cross-country phase and then unpack it again. The rest of the stuff for event organisers, it's amazing if you can have a treatment and or testing box for us. Somewhere that we can specifically say, bring your horse over here. You know, it's not at the side of a float. You know, it's maybe somewhere that's got some lights or something, just somewhere that we can sort of take a horse out of the hustle and bustle and be able to deal with it is really nice to have. Otherwise, most of your veterinarians that are coming have trucks full of you know, fluids and medications and stuff like that. So they're really the big things that I would love more event organisers to have.
Okay, and lastly, back to choke.
Yep.
How long should you wait to call a vet after noticing a choke? Should you wait for 10 minutes or not?
Yeah, choke is a funny one. I would have to say more than half of our calls, clients ring the moment it happens because there's horrible, copious amounts of saliva coming out of the nose. And I have to say it's not one where I race to jump in the car. I will finish what I'm doing first, because quite often you'll ring me back 15, 20 minutes later while I'm on my way and say, oh, it's better now. It's back to eating and the nasal discharge has stopped. So look, I wouldn't wait more than 15 to 20 minutes to call for assistance. But yeah, if you want to wait 10 or 15 minutes, just to take them away from whatever they did it with, whether it be the carrot or a bucket of food. And if it hasn't cleared in 10 minutes, give us a buzz. But yeah, a lot of them, they do actually resolve on their own.
Okay. Snake bite.
Yep.
What to do?
So snake bite is a bit of a tricky one in horses because it doesn't sort of present like anything. The horses may be a bit colicky, so they might be maybe sort of getting up and down or rolling. They may be depressed and off feed. They may have a decreased temperature, but it's not usually what we call pathognomonic or a specific set of signs for snakebite. So most of them we are treating symptomatically. Again, the earlier we get the anti-inflammatory and the fluids into them, the better it's going to be. But I have to say, I think I've maybe seen anti-venom used once because they've sort of seen the snake bite. Otherwise, we're treating symptomatically. So that's what we're tending to do with snake bites.
Okay. Back to an event.
Yep.
After a cross country, what do you consider to be the absolute minimum that should be performed at the vet check?
Performed at the vet check? Okay. So if anybody's interested, I'm actually doing a talk next Thursday for the Eventing Western Australia, but I believe it's open. I know the one that Sonia Johnson did a week or so ago was we had people from interstate attending it. So if anybody wants to attend that, I will cover quite a lot of the event vetting side of things, if anybody's interested in that. I mean, it depends on the type of event. The only events that require an examination after cross country is FEI long format cross country. FEI short format cross country is generally what we do. We call an optional cool down. So you will come across the line and have a heart rate and a temperature taken, and then it's up to the event and the veterinarians as to whether you stay around and cool down or you go back to your float. A lot of the time, the water truck is at the finish, so most people stay at the finish to cool down anyway. But generally what we're taking is a heart rate and temperature. And then what we want to know is we recheck that 2 minutes later and know that that's coming down. That's the key. It's not necessarily what it is as you come across the line, unless it's like 41 and too high to count. But it's how the horse is recovering as you cool it down. So what we don't want to see at that second check is for the heart rate to have gone up and the temperature to have gone up. If that's happened, then we know that you're not actively cooling that horse down sufficiently. And so we're going to give you a bit of a G up and say, oi, get over there and get water on and off that horse. Does that help answer the question? I mean, we're not doing PCV, TP blood tests when, we're not measuring glucose or lactate or anything like that. We're doing a heart rate and temp, and then it's more about how that recovers over the immediate time period than anything else.
Okay. And lastly, ticks. Do horses get affected by ticks, such as cattle ticks? And paralysis ticks, I would add.
Yeah. So I'm kind of lucky that I've been working in SA and WA and have seen very few of these. We do get the occasional kangaroo ticks in the hills here in WA, but I never saw, we don't have them in South Australia. So it's a festy Queensland, Northern New South Wales temperate tropical climate thing. Sorry, guys, you have all the diseases up there. Yes, they definitely can be. Obviously, your regular ticks, you may not notice anything until they become like a large enough lump to see, in which case they need to be removed, and you need to do all the same things that you do on those for people and small animals and have either the little tick things or make sure you're getting them without leaving the head parts behind. Horses can be affected by paralysis tic. Again, it's not something I've seen a huge amount of, but yes, they can. So if you're in a tick-prone area, just like you do with your small animals, do your regular checks, and all in the nooks and crannies, you know, in those butt cheeks, below the anus, up in under the groin and under the armpits, all those little areas that you can't easily see. Make sure you're feeling them and looking at them to make sure you haven't got any ticks, and get them off sooner rather than later.
Okay, and we'll make this one the last one then.
I don't mind. I'm happy to stay as long as you guys want to stay.
It's okay. So I'll modify this question a bit. What is the minimum heart rate that a horse should achieve after the cross country, in the sense of they've got down to an acceptable rate and you're happy to let them go?
Again, that's not a hard and fast figure. Okay, that's very horse dependent. We don't generally have, I personally don't, and the veterinarians that I have trained under don't necessarily have a single cutoff value for every horse. So it's not like we'll say, oh, it's got to be less than 80 or less than 60 and then you can leave. Generally, it's if you've got a consistent reduction in heart rate, then we're happy to say that that horse is recovering and you can leave the cool down area and finish cooling off at your float. It's important to note that when you leave the cool down area, you don't just stop. You don't just wander back and finish cooling down, because your values won't be back to normal yet. You just have to continue cooling down your horse outside of that sort of controlled environment. So generally, you know, you're usually coming in with a heart rate of between 100 and 120, or too high than that to count. Much higher than that, and the beats start to blur together. And they're usually coming in with a temperature between usually sort of 39 to 40. If at their 10-minute check, that's come down to 80 and 38 and a half. I might say and the horse is looking like it's starting to recover, so it's not blowing, it's quite cool and calm. I might have, again, we're looking at you guys as you're standing around the cooling area. We don't just let you wander off and ignore you. We're still watching you. So I've seen that horse have some green pick, and it's quite bright and alert. I might let that horse go. If you come back and the temp's gone up, or the heart rate's gone up, or they've barely dropped at all, then it's going to have to stay for more cooling. But I don't use cutoff values. It's about their individual recovery over time. So if a horse goes from 38 to 37, great, that's recovering. If it goes from 38 to 38 and a half, well, it's not recovering, right? But a horse that goes from 39 and a half to 38 and a half, that's recovering, right? So there's differences there. If I just use a cutoff value, it wouldn't apply to every situation.
Okay, and finally, for someone who hasn't read the rider manuals, but that's okay, how do you measure the respiratory rate?
Okay, so I didn't go through it because, you know, it's not a big thing for me, but you've got two ways. You can, well, you sort of pair a couple of things. Generally, I'm going to stand near the head, and I'll often have a hand near the nostril so I can feel the blow of the breath. And then I'm looking down the side of the horse and I'm watching the flank move in and out. And then I will count it over the 15, 30, 60 seconds, however long you want to do it, to get the breaths per minute. You can also put a hand on the flank. You might do that if you're, you know, if you're listening to lung sounds and then holding the flank as well to detect those breaths. But that's what you're doing.
And I'll throw in a final one, because you spoke very much about using a stethoscope.
Mm-hmm.
But you didn't talk about listening to gut sounds for people who might have a horse with colic. Would you recommend that people do that before they call the vet?
Look, it's not something that I would say owners would call or not call a vet, depending on what they hear. But I think it is good to know what your horse's normal is. Even amongst veterinarians, like, it was something that it's quite big in learning the endurance vetting side of things, because gut sounds is actually one of the parameters that we score on the vet gates at endurance rides. And so there's differences between good quality and bad quality gut sounds, but they're still sounds. So there's quite a lot of finesse to interpreting borborygmi or gut sounds in horses. But absolutely, if you get to know your horse's normal and then you put a stethoscope on and go, oh, I can't hear anything, and I'm using my stethoscope correctly, then I know that something's going wrong. And that is a useful piece of information to give us. If you ring us and go, it's got a heart rate of 52, it hasn't got gut sounds that I can normally hear, its temp's 37.5, he's off food and lying down, that's awesome. That is just the perfect clinical description to give us when you ring.
Okay. Thank you very much. We have a couple of people who've asked about how they can get details of the eventing WA session that's on next week that you're taking.
Yes, that's a good question. I know they are going to post the link to it the day before on the Eventing Western Australia Facebook page. I will have it on my page, and I will have it on my clinic page, Oldbury Equine Clinic. Other than that, that's as far as I can tell you, basically.
I'm sure people can find it.
Yeah.
Well, thank you very much, James. That was absolutely fantastic. Thank you, everyone, for attending. And we look forward to letting you know what the next one will be.
Thank you so much.
Thanks and good night, everyone.
Have a great night.
Thank you.